Hey, everybody. Welcome to this Starboard Portal presentation of COVID-19 FAQs for sailing programs. We're excited to be back here with you to discuss this evolving topic and hear from a collection of sailing program leaders who are already running their own programming. And also from Dr. Stephen Shapiro, who is a member of the Sports Medicine Committee with U.S. Sailing, as well as the Sailing Program Chair at the James Island Yacht Club in South Carolina. So to start off with here, I'm going to give a couple of U.S. Sailing updates, and then we're going to dive right into the panel presentation. And just want to start off by thanking everyone who is a U.S. Sailing member and encouraging you to join or renew today to help us keep this content coming. It's been a crazy year so far, and I'm sure there's a lot more to learn in the future here. So your ongoing support makes a huge difference for us. All right, so I'm going to kick it off with a few U.S. Sailing updates. Some of this is familiar, but things have evolved a bit in the last month or so. Many of the U.S. Sailing training courses have been adapted at this point to have an online component. So the new level 1 instructor course is a hybrid of online and in-person training. And the online courses have been running, and the next step for many candidates will be to take the in-person 2-day evaluation course, which will be scheduled beginning at the end of this month and going through the rest of the summer and this year. So we are having those in-person courses beginning to get on the calendar, and that will also apply to the level 2, level 3, and sailing counselor courses. Another exciting update is that the Reach Educator course is going completely online. So that will be a 1-day course with all of the components online. There is no in-person, and that's a great opportunity for sailing programs to include STEM education in the work that they do, to get a lot of practical hands-on background in that before they get started. And certainly, especially in this unusual year, including STEM education in your sailing programming is a great opportunity to keep kids engaged, try something new, and provide a lot of value to your participants. From a racing perspective, a little over a month ago, the decision was made to cancel the summer youth and junior U.S. Sailing National Championships. So that was the youth champs, the youth match racing champs, the junior women's single-handed and double-handed champs, and the Chubb Junior Champs. The adult championships, most of which happen in the fall, are still being evaluated. Several of those are still planned to go forward, and there are updates on that available on the website. USA Junior Olympic Sailing Festivals, which happen all year round, are scheduled. There are some that are scheduled to potentially take place this summer, although many will be postponed or canceled, and that's on a case-by-case basis depending on the host area and situation. And we're also coming up with some fun alternative activities for JO participants from past years to stay engaged this summer. So stay tuned for that. And lastly, the Youth World Championship has also been canceled by World Sailing. That was going to take place in December in Brazil, but that's been canceled at this point. And they're in discussions about the future for that regatta for 2021. So that's just a brief synopsis. There's much more on the U.S. Sailing website and the weekly updates that are going out on Mondays in the weekly lift. So now moving on to our main event here. Want to provide a brief disclaimer, as we do on these, that we're trying to be helpful and provide resources and context to help sailing programs navigate this situation. But please make sure to do your own research with legal and medical professionals and get your background for your specific club situation or program situation, because it is so different in different parts of the country. I also want to lead off with some recommended resources. Over the last couple of months, many of us have been digging into this topic and trying to learn where to find the right information that really helps paint the picture. So first and foremost, the Center for Disease Control has released considerations for youth and summer camps, along with considerations for youth sports and many other areas. So please refer to those. Those are the authoritative guidance on how to operate. And certainly there's a lot of new resources there. When we had our last panel on this topic about a month ago, the CDC had not yet released any of those considerations. And so now they were released, I believe, on May 19th. So we have those to refer to, and you'll see in this presentation, we're going to refer to them quite heavily as well. The U.S. Sailing has produced a handful of specific resources that are available on our organization's resource page. Specifically, there's guidance for junior sailing programs, guidance for return to competition, and a sample of a waiver template that you could then modify and use within your own program. Of course, remember that your own legal professionals should take that template and use it as they see fit. And that is not a finished product, but it should be a good starting point. Another organization that I have been referring to a great deal is the American Camp Association. They have produced a field guide for summer camps that is very comprehensive. It speaks to a broader audience of all different types of camps, but certainly highly recommend digging into those resources and picking out the pieces that could be helpful for your programs. And within that, the Association of Camp Nursing, which is related to the Camp Association, has some great specific templates and medical information, things like screening forms, how to do temperature checks, things of that nature that we're going to touch on here a little bit, but they have some increased detail there. So that's just a small sample of what's out there, but I think these are some of the key resources that everyone should make sure they're familiar with. So with that, I'm going to introduce our panelists. We have joining us Dr. Steven Shapiro, who is a member of the U.S. Sailing Sports Medicine Committee and also the sailing chair at the James Island Yacht Club. Dr. Shapiro, would you mind introducing yourself for a minute?
Oh. You put me on the spot here. I have been a sailor for maybe 30 years. I was in my youth a catamaran sailor, like speed and all those fun things to do, and had two children grow up at our little club and learned how to sail, and been involved with the sailing program for 25 years. And I also was I have been the medical director of Race Week, which is the largest keelboat race in the United States. So, and because of that, they put me on the U.S. Sailing Sports Medicine Committee.
Well, thanks for joining us. And I know we're going to ask you some of the tougher questions because there's so many, sort of medical uncertainties in this area, and we appreciate you providing your insights. The other members of the committee here, or the panel, I should say, are folks who are already running sailing programming and really wanted to bring them into this conversation so that people in parts of the country that are not yet really operating at full capacity or are just getting started as the summer months approach here could maybe learn from some of the experience of places that have been operating in the last couple of weeks or months. So our panel is Jesse Andrews from Kaneohe Yacht Club in Hawaii. Jesse, do you want to say anything to kick us off?
One second. Hi, guys. Sorry, I was on mute. Yeah, it's great to be here. I've been working at Kaneohe Yacht Club for just over 20 years and also assistant coach with Andy Johnson at University of Hawaii. And if I seem distracted, there's 2 sailing classes going on in the background. So you'll be able to see kids like rigging up, I think, open bicks and toppers in the background, but great to be here.
Thanks, Jesse. And then our returning panelist, who was also with us back in May on the last Junior Sailing Program panel, is Chris Wright, who's the Waterfront Director at Mission Bay Yacht Club in San Diego. How you doing, Chris?
Good. Hanging in here. We've been working here for almost 13 years now, and kind of built our program up from the ground up from where it was, and now kind of running the adult program as well as the junior program. We've been having some adult races already going on, some youth after school stuff, private lessons, as well as some weekday club events for small boat racing. So we're already in full gear and kind of going forward.
Excellent.
So glad to be here.
Thanks for coming back, Chris. We liked you so much, we decided to do it again. And last up is Jodi Weinbecker, who's the Waterfront Director at the Florida Yacht Club in Jacksonville, Florida. Jodi, how are you?
Hey, good afternoon. I've been here at the Florida Yacht Club for about 6 years. Prior to that, I was at the Southern Yacht Club in New Orleans, running their waterfront program for about 4 years. And we are up and rolling. We actually are probably one of the areas of the country that Florida in general has been hit maybe the least impacted on this, or has been able to come back open the quickest. We were very fortunate that we actually kept sailing kind of through this whole thing. So I can touch on that a little bit if anybody has any questions on what we've done with that. But we are pretty much through week 1 of our 10-week program for the summer. So we are full rolling with things open. Wednesday night races are open. We are getting ready to travel to some regattas as soon as things keep rolling here. So I'm happy to be here. Thank you.
Yeah, thanks for joining us. Absolutely. And, I think anyone who's following the news realizes that different parts of the country are experiencing this virus very differently, and the regulations are also very different across the country. So, we can get into the details of what you all are facing in some of your parts of the country, maybe as we're going on the fly here, but just want to state, of course, that everybody's operating off a slightly different playbook. And to that end, this is reusing a slide from the last time we had this presentation, but just to make it clear from the get-go that really the timeline for reopening or staying open is being dictated by a variety, really a patchwork of state and local authorities. And it's critically important that every program, every organization knows which authorities apply to them in their location and is in contact with those authorities, is getting the latest updates and in communication with that. So that may be your governor's office. It could be a state or local health department, city and county official department. In some locations, there might be rules about what is acceptable on land that are different than what is acceptable on the water. So knowing who to go to for that information, I think, is job number 1. Also, as I mentioned, the CDC has released sort of general guidance. So the CDC guidance can be referred to as a sort of backstop for generally what's going on. And one of our goals today is to fill in some of the cracks with frequently asked questions that seem to keep coming up. So I'm going to go into 2 slides here on the CDC information. And you'll see at the bottom of the screen here, I've got a link. You'll see this link throughout the presentation here, because I want to make it clear that the CDC info is at your fingertips. You go to these websites, it is all listed there. And so we're taking it directly from the source. So this is the considerations for youth and summer camps that was released about 2 weeks ago. And it essentially is a risk assessment of lowest to highest risk within a summer camp environment. And it paints the picture of, small groups that stay together each day, physical distancing, outdoor activities. This is the safest, lowest risk scenario. When you allow campers to mix, that increases to that more risk category. When you allow campers to mix and you don't maintain physical distancing, then it's even more risk, and so on. And so it's certainly very straightforward in that, but applying it to sailing and our clubs is the real important topic here. Another resource that's similar, that's on that same CDC resource page, is for youth sports. So this is a little bit more about, probably dictated more towards soccer or lacrosse or things like that, team sports, but it also applies a bit to sailing and competitive sailing. So the lowest risk scenario here in the youth sports environment is skill building drills, conditioning at home, doing things alone or with your family members. Increased risk is then your team-based practices, and then it increases with more risk when you add competition or especially travel competition. So we've seen a lot of discussion about the return to racing side of things within sailing, but this is another lens to look that through. So please refer to the CDC info. That's sort of what we're touching back to. You'll see screenshots here the whole time. And there's so many other great resources. So we're going to dig into some of the frequently asked questions next. I have a handful of pre-canned topics that we'll touch on, and Dr. Shapiro can provide a medical perspective on. And then I do have the chat box up here. So we are going to do our very best to have time at the end to talk about some of the specific questions. So if you have a burning question, go ahead and put it in the chat box and we'll do our best to try to get to that. So, so Dr. Shapiro, I'm going to put you on the spot here for the first two topics, because these are things that really sailing professionals are not used to, but medical professionals are. So talk to us a little bit about health screenings and your perspective on the process of, say, checking in sailors at the beginning of a camp session, checking in participants before a day of sailing, et cetera. And what I have on the screen here is just a screenshot of that part of the CDC guidelines.
Well, I think that if you read the guidelines, and I think many of the clubs that are already have started doing some health screenings. One of the questions that was asked, that we wrote about, the committee wrote about frequently asked, was who should do the screening. And you don't have to be a health professional to do it. I think that if you have a list of the questions and they're really easily found, have you been sick? Have you been in contact with somebody with the virus? A litany of about maybe 6 or 7 questions. Anybody can answer those, and if they're answered yes, then it has to be escalated to the program director to make the decision as to what is the next step. What is your protocol? I would say that most protocols would be to send that child home. Along with that. Now, the other thing that people are doing, which I think is reasonable to do, is to do a temperature check. And again, you don't have to be a professional to do that. There are these infrared lights, temperature gauges that are pretty easily used. And I think that every day, both the instructors and the students need to be tested to make sure that there's no one with any obvious symptoms of the virus. With that, obviously, hopefully your programs will have small groups, as one of the slides said earlier. I think small groups put you at less risk. There's some really interesting statistics that have come out now, that you're 18 times less likely to get the infection in the outdoors than the indoors. So I think if you can keep your kids outside and in the air and keeping them from being inside, then you've done them great favor. I think if you have small groups, if someone were to actually get sick, then it doesn't ruin the whole program for you. You don't have to send everybody home. We call our system the pod system. We're going to have 6 kids in a pod, and then you can make a decision. I particularly like the very first slide about low to highest risk. One can make an assessment of how well you do your pods and how well you do your social distancing in terms of making a decision as to whether you need to send everybody home or how that works out. I would say that the number one thing that we have to do is communicate with the parents. We need to let them know exactly what's going on, because ultimately they make the decisions as to what decisions they want for their kids or not. So I think that, I think some pretty simple things to be done, but if we do them consistently, keep the 6 foot, wash our hands, keep high touch areas cleaned, I think we can really make a big difference in terms of spreading. And I also think that you need to know your area in terms of, what is the infection? Is it prevalent in your area? Is it not? Many of us live in areas that may not have very high frequency. We live on James Island. It's a an island that has about 25,000 residents, and so far we've only had 44 cases. So I think we have a low incidence, and therefore, as the other slide, one of the slides shows, most of our students are going to come from our local area. Again, it's going to be low prevalence. But if you have a program that draws from a lot of different areas, or you have summer influx of people from out of the area that have second homes or vacation there, then I think you have to be much more aware of what's going on. I hope that answered your question.
Absolutely. Yeah. I think, and on the topic of health screenings, I don't know if any of the other folks in the panel have a real world experience that's working for them, or anything they'd like to add. Nope.
Well, I think communication, just hit back on the communication piece, just letting the parents know exactly the steps you're taking. And then in my letter that I sent to all the parents, I just put in there that, this is what we're doing. We're doing temperature checks. We're doing asking the screening questions. We're also going to be social distancing. We got the outside hand washing stations, small groups. And then kind of the last note in there was, and we're still a kids camp. So we're doing as much as we can, and we are taking this very seriously. But it is still, the choice up to the parents, that they are still saying that, yes, I understand, they're going to do the best they can, but this is still an area for kids to be out and together.
John, I think one of the important things is also compliance. I think that you need to let parents know that there are going to be rules, and rules need to be followed, and there are consequences for not following rules. The other thing is, which I think is really important, is to say to parents that if your child gets sick with the virus, that you will refund the money. We don't want people to say, "Oh, I spent this money, I'm going to send them anyway." We need to get a cooperation between the parents and the program to say, it's okay. If your kid's sick, we understand that, and we're not going to penalize you for having a sick kid. Now, if your kid can't follow the rules, then I think you get penalized. I think, you can get sent home and not get a refund.
Right. Absolutely. Yeah. Certainly want to encourage or make it 100% clear that no one who might be sick should come to the camp. And I think providing that refund option, or, a prorated refund or something like that, just make it as easy as possible for people to opt out if they think they need to. And so we can come back to health screenings if it comes up in the questions here, but the other kind of really difficult topic to wrestle with here from a medical perspective is, what do you do if someone is sick, if they're showing symptoms, or even if they eventually maybe test positive? How do you manage that from your perspective, Dr. Shapiro?
Well, and again, I think that it's not an easy black and white question. If you read the CDC recommendation, they would say automatically you should quarantine the group for 2 weeks. But again, there's a lot of data out there now that we didn't have originally. That your likely infection is if you spend time with somebody 6 feet without a mask for more than 10 minutes. So, if you do your social distancing well, if you have your groups wear masks as much, then you might be in a lower risk. And again, maybe not exactly what CDC says, but you might want to have some hierarchy in terms of what to do based on how well you can comply with these other recommendations. It's going to be difficult, and that's why I like the idea of little pods, because at least if you have one pod of 5 or 6 kids go, then you don't lose the whole program. You don't lose all your instructors, and the whole summer is a bust. The other thing is, which I meant to say, is just because somebody gets sick doesn't necessarily mean they have the virus. And so, again, if somebody's sick, they get home. We should encourage them, if they have the symptoms of the COVID, to be tested. If they test negative, then you're really in good shape. If they test positive, then you can do your hierarchy of what to do. If a parent refuses to get tested, then you're really in a real quagmire there in terms of what to do. And again, I go back to how well you're running the program. If you can't keep social distancing, if you can't have small groups, if you can't, do the, clean the boats and do the things that you're supposed to do, then I think the pod has to go home for 2 weeks.
Right. And to your knowledge, is testing becoming more available, or at least in some parts of the country, to the point where it could be you need to go home for 2 weeks and self-quarantine, or you need to go seek out a test and come back with a negative test? That's a question I have.
Well, I think there are, again, depending on the part of the country, but there are many, many areas in which testing is now relatively easy to get. A negative test is reassuring, but not necessarily the whole story. There are false negatives. Again, I think we're going to have to play that by ear. I think a negative test is reassuring. We ran into some family friends of ours whose son got sick, and they were all worried about it, and they ended up doing a test, and he had had another virus that just mimicked some of the signs, but not to worry about having this particular virus. So you still can get sick.
Absolutely. Yeah. And one of the things that I didn't include here in the slides, but I believe it was in the discussion from the sports medicine committee, was to seek out a medical professional who could advise your organization or program on these issues, so that you have a little bit of extra knowledge and background. Is that something you would recommend people do?
Oh, absolutely. Many clubs have fleet surgeons, so as a position, but and again, the socioeconomic class of a yacht club, I'm sure there are physicians, and I'm sure there are physicians that would, and or nurses that would volunteer some time and energy to help on this. I think that's a great idea, an important idea to do, to at least to have some other resources. But again, maybe it's your local hospital, maybe it's your primary care doctor, your pediatrician who takes care of a lot of the kids in the neighborhood. There are lots of resources out there, and I would avail, the club of getting someone along the way. I wonder, for your programs that are going now, do you have a physician associated with it? In San Diego or Hawaii or Florida? I guess nobody's answering.
Oh, Chris, I think you're still on mute.
We don't, but we have been reaching out to some members of our club that are in the medical field, and talking with them in regards of what to do if that does happen. And he has given us a couple, telling him that we're having our small groups, minimal interaction with those groups, and he says that's the best thing you can do, because if it does happen, you do have your little pod, as you say, to look at and keep together, and make sure that you don't cross over and, like you said, kill the whole program all at once.
Right. Yeah, and there are so many resources. I want to point back out to that Camp Nurse Association has great templates that could be a starting point for a medical professional to help build out a response plan, things like that. So the resources are out there, and certainly seeking out guidance is the best step forward. Well, thank you, Dr. Shapiro. I'm sure we're going to have more from you as we go here, but we wanted to talk about two of those kind of tricky issues right from the beginning. And I see the chat is going, and a lot of questions about some of the topics that we're going to hit in a second. So we'll just keep moving forward for a moment. Next up is sort of the social physical distancing topic. So these screenshot boxes are, again, from that CDC considerations for summer camps document, essentially spacing out folks as much 6 feet apart as you can, prioritizing outdoor activities. As you mentioned, Dr. Shapiro, outdoor activities seem to be much safer in general. Staggering schedules so that you're not having groups coming through the area at the same time, and creating those pods or cohorts of small groups that stick together. So those are some of the things that are in there. I'm curious with everybody here on the panel here, how have you seen that playing out at your facilities? Chris, I think this is from Mission Bay Yacht Club, this photo here. So any insights?
That's from our first day of club races about 2 weeks ago. And those are kids and adults in between races. And they, we did tell them before sailing, make sure you guys stay apart, when you do come to the dock. And, everybody listened, as you can see in the picture. It was kind of nice, but we've been really pushing the kids to, pretend, stay a boat length away from each other. And that's a really good gauge for the kids, is using some sailing terms on how far to stay away from each other. Planning on putting some circles in the grass and some, temporary stripes on the parking lot, and making sure that every group has their little, every kid has their little bubble that they're in, and, really maximizing the time on the water and minimizing the time on land. And, usually on our learn to sail class, it takes, 30 to 45 minutes to get on the water. And our goal is going to be 15 minutes, hopefully this year, and keep them on the water as long as possible. Our private lessons that we've had have been really good, and the kids have been doing similar things and lining up, not rigging near each other. When they do need help from a friend, they both put their masks on and come over and help each other. So I think they've been doing a really good job of staying distanced, to say the least. And there's photo evidence.
Yeah. Jesse or Jodi, do you have any examples of that?
We were able to sail opties and lasers basically through this whole time. We kept our spring race team group, just the race team group, continuing to come. We transitioned completely out of 420s and into lasers. And it's amazing, all those, little opti guys, even the Green Fleet guys who can't launch their boats from the floating ramp by themselves, all of a sudden can do it when there's just somebody standing there saying, sorry, can't help you. Come on, keep pulling. And I had a funny little quote from one of my opti kids that we are always telling them to help their teammates. And now we're telling them don't help their teammates. And then in a week, you're going to come back and say, help your teammates again. And I said, well, not really in a week, but in a couple of weeks when this is all over, we'll let you guys get back together and start helping each other with rigging and stuff. But they did a great job of rigging their boats in their space, brought the boats out. They were all, 9-foot boats with 3 foot of space between them. They all rigged next to their boats. Rigs went up. We did our chalk talks either outside, them standing near their boats. Everybody launched one at a time. It was really important for them to come back to the ramp one at a time. So they circled out at the ramp waiting to come in one at a time. We had one staff person kind of throwing the first dolly down or throwing the dollies down the ramp. So only one person was touching their dollies. It worked. It worked really well. And we actually had some of the best practices we've ever had because the kids really wanted to be there. So it was great.
Very cool. Yeah, we'll get back to that on the water part later. I want to hear more about how things are actually going out on practice. But Jesse, did you have any social distancing stuff?
Yeah, mostly that we started out with just rec sailing when we were doing our, the yacht club has been closed for the past couple of months, but the sailing, the board of directors are definitely helpful and they want to get the kids sailing. So we came up with a good plan just to have an open sailing hours 3 days a week. So that was going on for the past month. And then our sailing program officially started Monday with 9 or less kids per class, and that 2 classes in the morning are staggered by half an hour. And I'll show you a background picture that we have maybe a 50 by 20 foot ramp where the kids rig no more than 6 boats at a time. And then the managers opened up the lawn area to rig boats so they can kind of pre-rig over there. So we're trying to keep them separated in the rigging process. And that's basically the only time they're together. We're staying out of the junior clubhouse as much as possible and just doing talks outside. And we're lucky to be in Hawaii where we don't have much issues with the weather so far this summer.
Excellent. Awesome. Well, that's great. And next up, just briefly touching on face masks. I see several of you have one at the ready and probably are wearing that most of the time. This is again from the CDC, the cloth face coverings. And whenever, people cannot physically distance, or when they have to be indoors, things like that. And I mean, I think my 2 cents is that we're very lucky that many of us were wearing those face coverings anyway for sun protection. So it's not that drastic of a change. I guess I want to ask Dr. Shapiro if how do you feel about the buff, the face covering, UV protector, and how does that fit into this sort of cloth face covering guideline from the CDC? Do you think it makes sense?
No, I think from a sailing perspective, it really does make a lot of sense. One is people have been using them for years, and so it's something that people are quite used to. It may not be as thick as some of the other materials, but it's still a barrier. The science behind it is really interesting. There is about, depending on the cloth, between 50 and 70% reduction in the amount of large particles and small particles from you to other people, and maybe a little bit less from other people to get to you. And so it really does make a barrier makes a big difference in terms of getting the virus particles. And what people need to understand, it's not just getting the particles, it's the amount of particles that you get. So, and you can really, you can get some particles and never get sick, which is kind of the ultimate hope that we get. So I think it's great. I think there's a lot of pushback from some parents, especially maybe not sailing parents, about wearing a mask, especially on land. I think many of us have had some of those experiences already with parents about, it's too hot, or, they're going to get dehydrated and the like. And I would like to hear the people who've started their programs to talk a little bit about their experiences with parents and that issue.
In Hawaii, we haven't had any complaints. It does get hot. Like, I was doing a work party with the buff on yesterday, and you find we just have the rule, when it's practical, you're going to be wearing your mask. So we are periodically telling the kids that wear their masks, but once they're on the water, we don't have them wear the masks. And then mostly it's when they're rigging up and in close proximity, make sure that all the kids have their masks on, and as well as the instructors.
Yeah, here at the club at Mission Bay right now, it's actually mandatory for everybody to have a mask on property. I mean, we tell them if you don't, they're for sale at the front desk. Go grab one. We're providing all the kids with buff instead of t-shirts this year. But the one thing that we worked out with the local lifeguards is, when you're on land, everybody has them up. And then when you go out in the water, they need to be ready to go when you're on the water. So we're encouraging everybody to wear the neck gaiters and buffs, so that way when a coach or kid comes up, you can get a little bit closer if you need to. And they also asked us to do that as well, just so that if the lifeguards or somebody needs to perform a rescue of one of our boats, a member boat on the water, they're ready to, both lifeguards and members are safe. And it's people are really accepting it and going with it. We've got a little pushback of like, how is my 7-year-old going to wear a mask all day? Well, start teaching them now. This is kind of what we're asking parents to do. And we've been using, the private lessons and club races as almost like a training tool for our kids and members of like, hey, this is what it's going to be like this summer. Come down and get used to it. And it's, it is hot, but you can dunk it in the water real quick and you're okay.
I am into my first week of our summer program. We're calling it the soft opening. It's a smaller group of kids, just making sure all the systems are in check and everything's in play. I would say it's not mandatory in our area so much. Obviously advisable that people wear masks, but I did make it mandatory that the kids wear them on land. It is hard for the 5, 6, and 7-year-olds to keep them on. That's going to be that has been my most challenging group. They're pretty good about it, but I would say with the kids that I have here this time, that we're at a good 95 to 97% compliance. So I'm feeling like that's pretty good. There's a lot of reminding going on. I know as the summer goes along, maybe that'll get a little bit easier as kids come back more and it's less of that. But it's worked really well. And the kids have been, for the most part, really following the rules well.
Excellent. And I know that the CDC, through this website, I see there's a link here for proper use, removal, and washing of cloth face coverings. I wasn't sure if, Dr. Shapiro, you had an opinion on whether those buffs should be washed every day or rinsed off, or how that fits in.
Well, I would say they're not like any other, they're just like every other piece of clothing you wear. They probably should be washed every day. The interesting thing is that the virus is lipophilic, and soap and water really will destroy the virus particles. So it doesn't take much, and that's why washing your hands is so important. And you can use soap and water. You don't necessarily have to use an alcohol-based all the time, although that is much more powerful. So yeah, I would say, yeah, if you can, wash them every day, or get 2 of them and wear one and get one washed, alternate them. They're not that expensive. And
yeah,
and we, if you make them cool looking, the kids will really want them.
Right.
A
lot of folks are wearing them anyway.
Yeah, called Burgee on it. I think it looks cool.
Yeah. Yeah. And they do get a little sweaty. So I'm sure you probably want to wash it for other reasons as well. Speaking of washing here, so just want to touch briefly on hand washing and hand hygiene and everything. Again, this is the screenshot from the CDC that we're all very familiar with now, with soap and water for 20 seconds, hand sanitizer that's at least 60% alcohol, etc. So that's been drilled into us for quite some time. And our panelists shared a few examples here. On the left, we have Florida Yacht Club kids lined up very dutifully at their homemade hand washing station. On the right, we have jugs of hand sanitizer from Jesse in Hawaii. So I guess to start with, Dr. Shapiro, do you have any specific tips on hands?
No, I mean, more is better. Wash your hands as much as you can throughout the day, and remind the kids to keep their hands out of their mouth and their eyes, and mucous membranes, and I think, again, we're going to be, if we social isolate and we have boats assigned, again, the frequency of touching would be significantly less. I think, I'm going to digress here for a moment. The one area that we need to really think strongly about are bathrooms, and to to have clubs clean the bathrooms or minimize the bathroom use. Shower activity probably should be done at home, along those lines, because I think as you get into the bathrooms when you're indoors too, there's a lot of potential problems in bathrooms, and so encourage the kids to use the bathrooms before they come, or maybe naturally do something in the waters. But that's a tricky area, and I wondered what are you all doing in your programs at this point with the bathrooms?
Our club, House and Grounds people are on I think it's an every 30-minute washing. We only have 2 sets of bathrooms on the club, and they kind of rotate between them each 30 minutes, and they're doing a good job of just washing all the high touch areas. We also have, instead of, I like the homemade hand washing station I see there. We went the easy route, and we actually bought laundry sinks that you put in your garage, and those hook up right up to the hose, and we've bought 4 or 5 of those, and we're placing them around the club at all the wash areas as well, for the boats, so that way we can have people wash their hands as much as possible, and then having our staff also touch all the high, hose reels and crane crane buttons and all that stuff. But they're really focusing on the bathrooms. The staff is here at the club almost on every 15 to 30 minute window.
Wow, impressive. And
they had to hire more people.
A question from the chat here is, does rubbing your hands in fresh water or salt water, like over the side of the boat, does that help, or you got to have the soap particles, or you've got to have the disinfectant, the hand sanitizer?
Well, clearly your friction will get particles off your hands, but but it won't get all the particles off your hands. So you really want to destroy the particles, and that's either through soap or through a 60% alcohol-based sanitizer. So yes, it's better than nothing, but it's again, we want a higher level of sanitizing your hands.
Right. And we already touched on this briefly here, but for the bathrooms, but cleaning and disinfecting, this has been a topic of long conversations. I'm sure everyone's been a part of this, navigating here the CDC guidelines, which really are about cleaning, i.e. sort of soap and water, and then disinfecting, which is, the disinfectant agents. And I will point out here that if you go to the CDC website, there are lots of links to cleaners and disinfectants, lists of approved disinfectants, a lot of information there to dig into. But I think a lot of folks are wondering just how is this done in a sailing program context here. And so got a couple of photos again here on the left from Florida Yacht Club, and on the right from a class clown in Hawaii there. So curious from the program directors here, what materials, what process are you actually using? Have you had any success figuring this out?
At this point, so the picture on the left is our staff. I bought, Harbor Freight backpack sprayer, and we're just using a 5% bleach solution, which is one of the things recommended for hard and soft surfaces. And I got 2 of them. We just fill them up. This guy's doing the kayaks and paddle boards. We had another person doing the sailboats. And we just spray, instead of the kids putting all the equipment away at the end of the day, it's definitely made a little more work for staff, but spray everything down at the end of the day. And it's worked really well so far. And again, everything's numbered, and assigning paddles that go, again, this is our kind of water adventures group. Paddles are assigned to the board, which is assigned to the kid. They use the same equipment all day. Same with all the sails, the sailboats, the rudder's blades, sprint poles, and all that have been numbered. So they'll be using that same stuff every day. But this has been very easy. Takes about 15 minutes because it's just a matter of spraying it down real quick and going on to the next group of equipment. So this has worked.
Yeah, good point about assigning boats. We've always done that, but between the morning and afternoon classes, we're disinfecting our toppers. Those are like the learn to sail boats, because we have different kids sailing them in the afternoon. We are on the healthy end of the spectrum. In Hawaii, we have about less than a case a day reported, and I think there's 11 active cases out of 1 million people on our island. So we're lucky that way, but we're still taking everything really serious and trying to, keep everything sanitized as well. And same peroxide multi-surface solution, we're using that on like the benches and the boats and pretty much everything. And we'll do that in the middle of the day between classes and at the end of the day, and found that to work pretty well.
Yeah, we're using just normal soap and water, and I will tell you that is a lengthy process, and we're trying to speed that up. Just the other day we tried to wash 3 sabots and 3 lasers, and it took us 30 to 45 minutes to get those 6 boats done properly, and then spraying them with a hand sanitizer solution after, alcohol-based solution. And it was a lengthy process, and we're trying to figure out what's a little bit better method than that. And the main thing is we don't want to destroy all the lines and sails by using some alcohol or bleach, based substance that could really disintegrate the lines and stuff quickly. So we're trying to keep the gear in good functioning order, but not destroying it by, using some kind of solution on it. So the soap and water is our plan, but I think, with more bodies and the coaches doing it after their class is over, I think it'll be a little bit speedier process, I hope. But the soap and water seems to be working really well too.
And was some discussion, I mean, there's been a ton of discussion on this topic as far as what to use, what solutions to use, what destroys equipment. Bob Adams at Zim did a kind of a report on Scuttlebutt the other day about solutions to use and kind of what works on soft surfaces and hard surfaces. And yeah, bleach sounds very harsh, but at the level that it's being mixed at, is less than a 5% solution. According to that study that they were doing, that it didn't have a major impact on the lines and the soft surfaces, because it's just not a high enough concentration to kill the virus, according to those studies, but not enough to really cause major damage. At least that's the research that I've done and what I've read.
Yeah. Any other sailing specific cleaning, disinfecting? I think it's a topic that, like you said, there's a lot of discussion. I did see in the chat someone asking about life jackets, and I think it's the Life Jacket Association of America or something like that has some very specific life jacket guidelines that are on the U.S. Sailing resource page linked there. So there are cases where life jackets might have a certain specific guideline that you can follow. Jesse, I seem to remember you stating something about the state of your lines and sails, and that they, in a Facebook post or something, that they didn't seem to be getting damaged. Oh, I think you're still on mute.
Yeah, I did a bit of an experiment because we've had this it's a peroxide solution where it's only 6 ounces per gallon, and my manager has like a premix sink tap that you can just fill up these bottles. But anyways, that picture you see of the 2 life jackets, I was spraying one every day for like a month. They were both really old and UV torn, and I was just seeing if one of them would have the peroxide would have a difference in being able to rip, and leaving them in the sun. And I didn't notice a difference between the two because it is really watered down at 6 ounces per gallon. And so we found that to work pretty well. And we mostly use it on the hard surfaces because the sails aren't really being shared as much by the kids. We're doing all single-handed sailing so far.
So ideally, it makes sense to go ahead and have a camper have their own life jacket and not really worry about it if you can do that. West Marine used to have a program where they would donate life jackets to programs. I don't know if they still have that or not. For those individuals, campers who can't afford a life jacket, maybe it would be a nice gift, especially if West Marine is still doing that program.
Yeah, and I'll plug MTI, which MTI life jackets are great for sailing, and they're a U.S. Sailing partner. So U.S. Sailing, there's a member discount if you go to the U.S. Sailing member page, and you can get a discount on MTI life jackets for your program. And Dr. Shapiro, one of the questions in the chat here has to do a little bit with periods of time. Like if you leave a boat out in the elements for a period of a day or something, does that mean that you don't necessarily have to wash or disinfectant, or what's the thinking on that?
Well, I think I don't want to get in the political realm of things, but clearly the virus has a half-life in the environment, soft surfaces, hard surfaces. There is some data out there that in the elements, humidity, heat, sunshine will have a major impact on the survivability. I don't know that anyone's done any experiments on sailboats and rigging and sails and the like. So, again, I think that if you, the simplest thing you can do is to get soap and water and wash the boats, between uses of different people. Ideally, if you can assign a boat to a kid for a whole week and he's the only kid that does it, you don't have to do as stringent in terms of keeping it sanitized. If you're a program that you have to share boats, then clearly between sharing you have to do it. I think one of the things that I know in our area is difficult is actually finding some of the more popular disinfectants that are on the CDC list, and it's hard to find some of these things because everybody and their grandmother is getting them. So again, if you can get it, get it, and just be mindful of the high touch and different people touching things.
Absolutely. Excellent. And then, to wrap up here, and then we'll try to get to a few more questions. The fun part, once we get out on the water and we can, get in our own little sailboat, just curious from the program directors here, what's going on when you get out on the water? How's it going out there? Anything different that you need to do once you're out there on the water, or is it pretty much business as usual?
For us, we haven't changed too many things other than our safety boats. We were limited to 2 people per boat, and that mandate got lifted yesterday. But so we just made our classes, 9 or less, and one person outside that family are the rules for the safety boats and the coach boats. So basically, our program's running at about 1/3 of the size, just single-handed. And we'll probably open it up to double-handed now that they've lifted those restrictions. Now our new mandates are 10 or less per boat. So our club's going to start doing some Thursday and Friday night dinghy racing. Thursday night is the big boats. So we're lucky to be in an area that's allowing us to do this.
Yeah, what's been working is really just making sure that you communicate with the parents, let them know what you're planning, what the summer is going to look like. And, doing the private lessons and smaller class sizes right now seems to be working. We're getting really good traction on that. And like I said earlier, it's a really good way to get the kids. We only opened it up to our race team guys, our regulars. And those are the guys that are around all the time that, think they own the club, as we all know, and they're around. And it's really been a good training moment for them to get them used to what the normal is going to be this summer. And really having the designated areas for groups and classes and boat types, and just saying, okay, you're over there, this other group, you're over there, and really keeping everybody separate. And they just opened our beaches this week on Tuesday, so you can actually sit on the beach again. So parents are able to actually hang out and watch now. So we're slowly getting back to normal as well, but having those designated areas and those groups and the little small soft opening like you guys are doing in Florida is really working, and getting the point across to the parents, and communication, number one.
So sailing through, kind of being able to sail through the pandemic, my experience with that was, again, tons of communication with the parents, because, anybody that didn't feel comfortable, obviously we were in full support of that. But I have to tell you that in, the last 18 years of coaching, 17 years of coaching, it was some of the best coaching I've ever done, because the kids they wanted to be there. There was no place else for them to be, right? They were at home, they were homeschooling, they didn't get to see their friends. They were on Zoom calls all day. They wanted to be outside. Even from a distance, they got to be in touch with at least their sailing friends, if not their other friends. They really, really wanted to be there. Watching the information go in and translate into the sailing without any of the other distractions going on in their lives was really kind of a special time. I'm so fortunate that we were able to do that. I think I've seen so much more growth in a lot of our kids because of that. There was no other distractions going on. There wasn't, I have to be here, I have to go there, this other sport, this other thing, my parents picking me up late, all these other things. So I was very fortunate with that. Moving forward now into our summer program, we've been a good probably 4 weeks into the restrictions of lifting for multiple people in boats. We've been over, the over 10 people or under 10 people in a boat for, I'd say, almost a month already. So we've been doing J24 Wednesday night races. That's been going really well. We were able to start with our soft opening. We did do the multi-person boat. So we have the kids on Flying Scots and J24s. I think there's a picture on there on the slide, maybe someplace, John, where the kids are all, they're on the J24, but they all have their buffs on and they've been following the rules. When they're on the boat together, they've got their buffs on. When they're on land, they've got their buffs on. Again, it's really, so far, everything's been going well. And again, I'm fortunate to live in an area that we have been allowed to do under restriction, but allowed to continue to do what we've been doing.
John, I'd like to make just one point about on the water, and that is safety. And, there are going to be situations in which you may have safety will have to override, social distancing, maybe even wearing a mask. The life of a child, the safety of a child, will oversee. We need to do that as a priority, as opposed to, take time to do something else, try to stay 6 feet away, the whole 9 yards. Again, it's the amount of time and distance. So, even if you get close to somebody for a minute or two, the likelihood that you're going to get infected is small, even if they, and fortunately, most of the kids will not be infected. But I just have to underscore safety first, and again, communication to the parents to say there may be a situation in which we're not going to be able to abide by the social distancing, the face mask, the washing of hands for the safety of your child.
Absolutely. Yeah. And I think, as Jodi was saying earlier, that things like on the launch ramp or when sailors are rigging, they can probably figure a lot of that out on their own, even if they've been getting help in the past. And so this may be a good opportunity for them to really learn to rig the boat themselves without an instructor hovering over their shoulder. But certainly a capsize recovery, a sailor in the water, all those things that we have these, U.S. sailing training courses for. The whole purpose of that is to make sure that we minimize the risk of those accidents. So absolutely agree with you that you got to be in the moment, and certainly instructors or safety boats are going to have to not hesitate at all to do that. Another thing I want to just touch on, we could probably do a whole nother webinar on this, but single-handed versus multi-person sailing, and in sort of doing a deep dive on those CDC guidelines, the lowest risk category there is essentially individual activity that is socially distanced, right? And that's clearly single-handed sailing, I think. And so in order to fit that lowest risk category, I think single-handed sailing makes sense. And then the kind of medium risk scenario starts to bring more people into an activity together. And that's where, double-handed or other, J24, other multi-person boats would go. And that applies to adults too, obviously. So as different regions of the country, like Jesse was saying, as Hawaii is changing their rules about how many people can be on a boat and things like that, that evolves. But it's also a choice of the participant, the parent, anyone else, of what activity they want to undertake, and so there's no perfect answer for that, except for if you want to be extremely low risk or lowest risk category, go single-handed sailing. And I've heard from, I think it was, may have been San Diego Yacht Club, but the double-handed sailors who usually sail FJs or 420s who are now digging into the laser, and they might not be the perfect laser size or have that background, but they're learning a whole lot and they're having a whole lot of fun digging into that new activity. And so there's always a bright side to look for sure.
Yeah, we've here in San Diego, you know, it's we are still household only sailing. That is still the rule here in San Diego. And so it's, you know, our laser class has almost sold out the entire summer already. And, you know, people are really looking to buy lasers everywhere, and they're kind of hard to find nowadays. But, you know, there is, you know, John, you're right. All those kids that you would see normally doing double-handed, and they want to hop in and do lasers all of a sudden and getting back into that single-handed. And we've really been pushing that as a club, is just single-handed, or, you know, we've had tons of single-handed Solings and Thistles and Lightnings out there racing club races, you know, and they're no spinnakers and they're a little overpowered, but it's, you know, they're out there doing it. And it's kind of bringing back those grassroots sailings, as we always talk of, like just going out and having fun and going out for a cruise.
You know, John, I think you made a really important point. You know, as we open up the country, one of the things that are your social distancing group, you know, so your family members. So encourage, you know, siblings to sail together if they want, you know, in a double-handed boat, or a father, you know, son, daughter, mother kind of combination really works well. And then what you see is as the country opens up is that your social distancing group becomes bigger, and then it becomes easier to sail in a big boat, you know, a J24, or because those are the people you social distance with anyway, and so they're what I would call your extended family. So I think that's how it's going to grow, and I think that's how we continue to put people in the lowest risk category if we do that and encourage that.
And I wanted to just jump back in and say something real quick about the communication again. I think communication this year is going to be is definitely more important than it's ever been. And you know, the big thing was, you know, the communication to those people, for us being allowed to have multi-kid boats, that we just said to the parents that, you know, you've signed your child up for, you know, a boat that's going to have multiple kids in it. You know, if you are not interested, if you're not, you know, okay with that, that's perfectly fine. Let us know, and we'll put them in a class where they're in their own equipment. But you're knowing that, you know, these are the steps we're taking to be able to keep them social distance, to keep their buffs on, to, you know, keep just that group away from the rest of the other groups, that these are the kids they're going to be sailing with the whole week, just those kids. And then moving from there with, if they want to switch to something else or get a refund because that didn't, you know, they're no longer comfortable with that, that is perfectly fine. And we are happy to do that.
Yeah, it's exactly. It's a moving target. So as these regulations change and everything, and the situation changes, we'll be keeping our eye on it. One more question from the chat before we wrap up here, which is just an interesting one. When it comes to being out on the water, let's say there's a group of 10 Opties or Bics out there, or Sabbats or whatever, and they're on a crowded starting line. So they're really packed in there tight during that, you know, starting sequence. I guess this is for Dr. Shapiro. I mean, where does that fit in within social distancing in your mind?
Well, again, it may not be perfect, you know, it may not absolutely meet the 6-foot rule. It may, you know, sometimes people's lines are not all that tight, but again, it's also the time. So, you know, again, the idea is it takes time for you to get enough virus. So if you're in a line without a buff on for a minute, the likelihood that you're going to get infected is low. I mean, again, it's all risk. It's stratification of risk. If you're that nervous about it, you put a buff on. If you're really nervous about it, maybe you go to the pin end, with the unfavored end, and take off, and or not race, not do, you know, not participate, do more solo sailing. But I think that we're very fortunate in sailing in that most of the day on the water is going to be 6 feet or more apart. So I think we have that. We really have an advantage, and in reality, we're going to be one of the few camps in the summer that really are going to be able to really do a good job, I think, in terms of following the CDC recommendations.
We've been joking with the kids, you know, like wear your buff on the starting line, and then when you tack on somebody, pull it up before you tack, you know. That's been a running joke through the team.
Yeah, I mean, it seems like obviously there's so much unknown, and certainly looking at all the information coming from other sports, other activities, so much variety, whether they're indoor sports, outdoor sports. But yeah, definitely hope that sailing continues to be an activity that can be done safely, and really very impressed by how all the sailing programs out there, you guys included, have been adapting and just shifting it up. And it's interesting to hear also the success stories of cases where it seems like the new format that programs are taking on is actually maybe more effective, better for teaching or better for the business. I know, Chris, you were saying that some of the changes that you've made have strengthened the program in some ways, right?
Yeah, it's just we, you know, having 2 coaches dedicated to 8 kids instead of, you know, the 6-to-1 ratio that a lot of us go by. And it's brought a lot of smaller group and more like intimate coaching and one-on-one coaching moments. And the kids are really enjoying that one-on-one activity. And, you know, it's more focused on that class. You don't have a class of 20 kids where you have those couple kids that are causing problems. You have these small groups that you can really connect with. And, you know, it's making it a lot easier on the coaching staff and on, you know, just planning purposes as well. It's actually a really good system that we've developed for this summer. And I think, you know, it's going to work really well.
Yeah, it's great that the yacht club's supporting your instructors like that. Ours is the same, where they realize that, you know, we're not going to be making as much profit, but the important thing is just having the kids out there and having everything run safely. And I think the starting line is the least of our worries. I mean, like Dr. Shapiro had a good statistic on, was it 80% less likely outside versus inside? But on the starting line, the boats are 5 feet wide at least and 8 or 9 feet long. So with the wind blowing in your face, it's I think double-handed sailing is much more of a high risk than just worrying about a starting line.
I would agree.
And I just wanted to chime in on, you know, we are outside and house sailing. I think this could have the potential to really grow our sport. I know locally, really there's still a lot of camps, especially, you know, the overnight camps that kids go to, you know, overnight go away camps for 2 or 3 weeks at a time. A lot of that's been canceled. I'm getting a huge influx of kids who aren't going to the normal camps they go to. And their parents are saying, if I'm going to send them to anything this summer, outside, you know, on the water, in the sunshine, that's what I'm voting for. So I think I'm going to end up getting a lot of kids this summer who've never tried it before because, you know, they were involved in all kinds of other sports. And now is their parents kind of push into trying to do something outside, which I'm really hoping is going to be great for our sport universally, as people are able to open back up and other sports maybe aren't able to as quickly. That's really going to help us as an industry to continue to grow a lot.
Super. I want to encourage everybody to be, you know, as safe as possible. Let us know what resources you need in order to do that, because we want to keep sourcing those and compiling that for everybody. This Sailing Leadership Forum Facebook group has been active for over a month now, and there's a lot of great content in there already. But certainly if you post a question, you can be quite sure that you'll get a bunch of really experienced people chiming in on your situation. So go there and keep sharing what works and share your challenges. With that, I think we'll wrap up unless anyone has any final thoughts. Looks like we're good. All right. Well, thank you, Dr. Shapiro, Chris, Jesse, Jodi. Thanks for joining us. Thanks everybody from home. Stay safe. Have a good weekend.
Thank you.
Thank you.
Cheers.